Okay, thank you very much. I was responsible for gathering some of the main ideas of the different discussions we held today. We wanted to make something deeper, but it was impossible due to time limits, so we may just give some comments now, but I'll send you a final version from these different times we have had today. Some of the conclusions from the breakout sessions were not included in my remarks, but they will be included later on when we include the suggestions from Florencia and from Raquel. Well, to adjourn our session, let me remember first the goals and the objectives we set for the day today and what the topics were for the debate. First, we want to discuss how important is to assess the impact of the programs, their cost effectiveness, and the results they bring when it comes to public policies, what sort of consequences we may have, what sort of investment we need. That was one of the main topics we discussed in many at different times along the day and in the breakout sessions. Another topic which was very interesting when we were planning the workshop was scalability of these programs. All this exercise of exchanging ideas and doing some pilot experiences and experiments, how can this be related to the implementation of a public policy, and what kind of red flags we should identify first to ensure that quality will be warrant and that the scalability will keep all the quality criteria we need for a public policy when it is implemented. Another important topic has to do with sustainability of our programs. To be sustainable in the future is not sustainability on the long run, but also the funding issues and the clarity when it comes to explain the programs and the lessons learned so far should be sustainable as well. And the fourth goal for today's session that may contribute to this world debate has to do with institutionality and governance of the policies, the structure and the architecture of the different countries, and what they use to implement and follow up the public policies. So based on those goals and keeping in mind this framework, some of the suggestions that popped up in these breakout sessions or in the different talks we hear today are the following. The evidence suggests some areas where we should focus. I think we are clear based on all the presentations we had today that we have some key areas where we should focus from now on and must be defined as priorities for future interventions when it comes to assessment. Assessments are very important. We should gather quality information when it comes to follow-up and effectiveness of the programs, because these may build some trust on the public policies. We have some restrictions, of course, but we need focus on these conditions of measurement and assessment, and we should implement policies which are really sustainable and are really important for that population. We also discussed those variables that were brought to our attention, maybe some restraints that some models may have when they are on a larger scale. We should control more factors and we should adapt the models to every single reality in the world. The scalability of our programs can be profitable and can be efficient and could be also used and adapted to the infrastructure if we have the right personnel working with us. But we should start from what we have right here, right now. We should understand what we've done so far, but we should also work with what we have at our hands today. Maybe we may incur some mistakes if we try to do something totally new, which is totally unknown. When it comes to the different interventions we may have, we should also keep in mind the funding and the scope of each program. We should think on the different programs, and programs should be articulated. They have a synergy, they have touch points, and this interaction can be more interesting for the population. We heard a lot about Brazilian cash transfer program, Bolsa Familia. The way they manage that program here is really interesting. Another interesting topic has to do with set the right expectations about the models. A model after a pilot project with some controlled scenarios can work for a given reality, but maybe for a given another reality may not work. So we should create some compensation mechanisms that may balance this relation, and we should identify what's scalable and what is not. How can we tell what's subject to a scalability project, or maybe how can we deliver services or programs or products in a given place, in a given context, considering all the factors that may happen. When we scale a project, we may lose quality. That's why we need to follow closer the different goals, and we should train our staff to understand how to scale programs without losing quality. If we have cost effectiveness analysis for a given reality, for a given strategy in some territory, that's important, but we should keep in mind all the problems we have when it comes to scaling, when we have to a large scale project. Not because of the fact that the program was considered good in a given reality. I believe we should work even more to ensure that the program will work in a different setting. We should understand the quality requirements for that specific intervention. We should benefit from the leadership of local communities. They may act as monitors for quality. The importance of community agents, of local people, was discussed along the day, and they should interact with communities and they should be respected by their own communities. That's a very interesting thing. I believe the exercise should focus on these local natural leaderships. Another key point on scalability has to do with the acceptance from the target population that may enhance our work. In the second session, we discussed many topics such as the following. From pilot projects, we should set the different criteria that must be kept when the project goes bigger. We should create pilot projects for some aspects of the program, but we should be careful to do not draw conclusions from the different pilot projects we do to a general element of a public policy. Decisions must be careful and can't be taken from one reality to the other. I think we have different layers here. One's the public policy, and the other layer, which is an inferior layer, has to do with plans and the objectives and the goals of the programs and what we do with the population, what we deliver to them. We should work with the families, with self-care, health, family ties, among others. Work with families and the different possibilities of visits, in situ follow-up are a very interesting way to go, and I believe that may generate new mechanisms and new models to follow up and to understand the cost effectiveness of these interventions, which are more localized and they are more community oriented. We should define what can be scalable and what cannot. We should define the strategies and the systems. Contents should also be defined. Maybe we need to encourage more meetings like this, regional, local, global meetings that can provoke discussion and encourage debate and understanding how other countries are managing their own policies. Contents, I think, are paramount for our purposes. What the programs have inside of them, I think, is it depends on the country problems or the country situation. If we may think on create pilots of systems that can be cost effective, working together with parents and with visits, I think that methodology is very interesting to share and practice the best or share the best practices. I think the self-generated content is very interesting and it's very useful to understand the culture and the characteristics of each country. In the session 2, we also work with sectorial aspects, that we need a cross-sectorial approach in the national level. We all agree that from the different consensus we have reached so far, we are working from the integral development approach. It's a holistic way of seeing children, and I think this is cross-sectorial in nature. And that takes us to a new level, which is the cross-sectorial work. Is not easy. Is not only a call to different sectors to take part in a given meeting. Is not the sum of all the parts. We should also generate techniques, approaches, or methodologies that will lead this exercise and get somewhere else. So it's not easy, I know, but I think all the countries agree that that's the best way to promote these policies. We should support local governments when it comes to funding, training, and fundraising. We should generate capabilities where these capabilities are missing. We should follow up and define the quality standards. We should consider that these are elements that can be used to compare and monitor what we are doing. We should follow up the service offering and register the different platforms that we may have to record the information. Information systems, I think, were also discussed, but data access, timely data, accurate data are important. Cross-sectorial data, data coming from population, data that can be migrated easily from one group, from one age group to the other, are part of the basic premises in order to advance when it comes to decision-making processes. We should also encourage the follow-up teams to work on quality, on training. We need to offer good wages, training, recognition, acknowledgement, and experience sharing, and we should also encourage these people to be the owners of their processes. We should also take the decisions that are made in those meetings and take those decisions to the authorities. In session 3, once again, we identified some needs when it comes to quality information. We should have good data for measurement and for quality purposes. We should work on cross-sectorial scenarios, identifying bridges or interactions that can be used to understand the impact of each action. I think integral policies should be cross-sectorial, but they must be controlled by a transnational or some sort of agency that can follow up on this. Care to caregivers is also an interesting possibility. We should invest more, not only in training, but also in follow-up and care about people working with populations. Social investments are important. We may think on transformation, of course, but we need to focus more on early childhood development. We have some other interesting proposals, but we should always keep in mind that we need more money. We need more investments on early childhood. Investments should be sustainable, and if they are not, we can't ensure that the actions will take us to a good place in the future, and we will be exposed to this changing situation. Some policies consider the family as a whole, and we need to develop new tools and new approaches to understand the child as a subject. We should work more on visits and family support, and some other ideas from Claudia Costin, first talk of the day. She said preschool education is very, very important, but it's not the only thing we should focus on. We need more actions supporting the development, for example, family, social protection, nutrition, health is really, really important if we want to work about early childhood development. Assessment is very important to allow the scalability of programs, as long as we have factors such as context and uncontrolled variables. To reach a good efficacy, we should combine continuity, quality, and resources from different sources, and we need also mitigate problems in quality doing some exercises of follow-up. So as I said in the beginning, these are just some of the conclusions. We will add more conclusions to this, especially the contributions from the breakout sessions and the contributions from the other two speakers. Okay, thank you very much.
Obrigado, Constanza.
Thank you, Constanza. It wasn't easy, I imagine, right? I'm going to speak Portuguese. Now I'm going to wrap up the day, and so I'd like to thank all of you. We had people from different parts of Brazil, Pernambuco, Bahia, Rio de Janeiro, São Paulo, different places, Ceará, people from Latin America. The purpose of this forum was actually to cover Latin America, Chile, Uruguay, Argentina, Honduras, Jamaica, US was here too, Switzerland, England, in addition to all the online participants that I'd like to thank very much for their participation. We managed to get to reach a good outreach, online outreach. We had lots of questions, as you saw, and I'd like also to thank the National Academies, person from Kimber, who took this challenge to bring the forum to Latin America, and all the supporters of the forum who accepted this challenge to bring it to Latin America at a moment when early childhood is really feeling the backwinds and the favorable seas. So bringing the forum to Brazil at this moment with all these players from all over the world talking about the importance of investing on early childhood is really another key step to place early childhood at the place where it deserves, which is, as it should be, the priority of a country or of a region, Latin American region. I'd like to especially thank the supporters of the event here in Brazil. Thanks Danone, Early Nutrition, Hospital Sabará, Camargo Correia Institute, Banco Itaú. They helped us build this forum. I'd like to thank also the teams from the academia who have been working together with Fundação to build. It looks very simple. You come here, it's all ready, but it's a lot of work, I'll tell you. And finally, this forum will go on. So the next step will be Hong Kong. For those who won't be there, we'll be online again. And we hope that Brazil and Latin America will have a strong online presence in Hong Kong. Thank you all very much. It's difficult to see so many people at the end of an event, almost 6 p.m., so after 6 p.m. actually. And so if we have so many people, it is because we managed to keep a high level during the whole day. So once more, thank you very much, and congratulations to all of us.